We are students from the University of St. Joseph's Nursing Program, and today we are going to discuss high blood pressure, also known as hypertension, and high cholesterol, also known as hyperlipidemia. High blood pressure is when your blood pressure, the force of your blood pushing against the walls of your blood vessels, is considered too high. Normal blood pressure, systolic greater than 120 millimeters per mercury, and diastolic less than 80 millimeters per mercury. Elevated blood pressure, systolic 120 to 129 millimeters per mercury, and diastolic less than 80 millimeters per mercury. 1 in 8 U.S. adults, or about 7 million people, have high blood pressure. Only about half, 54% of these, have high blood pressure under control.
Who's at risk for high blood pressure? There are non-modifiable risks, meaning there are risk factors that we cannot change to prevent the risk of hypertension. They include family history of high blood pressure, genetic factors, race prevalence in African Americans, age, as we see the age risk increasing, gender, men are at a higher risk than females to develop high blood pressure. However, there are modifiable risk factors that can lower the risk to developing high blood pressure. They include obesity controlling optimal weight, tobacco smokers, smoking can cause blood vessels to tighten, causing blood pressure to increase, high sodium diet, water follows salt, so blood pressure will increase. Other factors that can be modified are lack of physical activity, excessive alcohol consumption, and certain medications.
How is high blood pressure diagnosed? Blood pressure is measured using a blood pressure cuff and a stethoscope. High blood pressure is greater than 130 over 80 millimeters per mercury. There must be multiple screenings on separate occasions. 3 readings within a few weeks to a month to confirm it. It is recommended the readings are taken the same time of the day. White coat syndrome is a phenomenon that indicates a person's blood pressure reading is much higher in a clinical setting like a doctor's office than an actual normal blood pressure. Some people become nervous around providers, so it is important to relax when your blood pressure is being measured. What are the symptoms? There are actually no real symptoms of high blood pressure. It is commonly known as a silent killer. This is because a lot of people don't know they have high blood pressure until they present in an emergency room with a deadly complication, which will be discussed in an upcoming slide. Some symptoms that a person may experience, but are very rare, are headache, nosebleeds, vomiting, vision changes, and dizziness.
Some outcomes of unmanaged high blood pressure are stroke, heart attack, heart failure, kidney failure, vision loss, sexual dysfunction, chest pain or angina, and peripheral arterial disease. As you may already know, these complications can cause severe discomfort and even death.
How to prevent and manage high blood pressure? Dietary salt restriction. As previously mentioned, salt follows water, so the volume of blood in the vessels will increase, which will increase the pressure in the blood vessels. Following the DASH diet, this diet includes eating vegetables, fruits, and whole grains, including fat-free or low-fat dairy products, fish, poultry, beans, nuts, and vegetable oils, limiting foods that are high in saturated fats, such as fatty meats, full-fat dairy products, and tropical oils such as coconut, palm kernel, and palm oils, limiting sugar, sweetened beverages, and sweets. Reading food labels is very important. Quitting smoking, as previously mentioned. Weight loss is also important, maintaining optimal weight. Taking antihypertensive medications as prescribed. Increasing physical activity will help to maintain a normal blood pressure. Limiting alcohol intake. It is important to also take regular blood pressure screenings. What is high cholesterol? Cholesterol is a substance that is found in the blood. LDL cholesterol, bad cholesterol, is the primary carrier of cholesterol, which brings cholesterol to the cells throughout your body and can cause cholesterol to build up. which with high blood pressure can cause the buildup to get pushed off the blood vessel walls and travel to block the heart and brain, which can lead to a heart attack or stroke. LDL cholesterol, good cholesterol, on the other hand, can benefit your health because these particles carry cholesterol away from your heart and other organs and deliver it back to your liver where it is passed from your body. Total cholesterol below 200, LDL cholesterol above 130, HDL cholesterol above 60 are all considered within the normal range.
Who is at risk for high cholesterol? Non-modifiable factors are the ones we cannot adjust in our lives to reduce the risk of high cholesterol. These include family history, genetic factors, over 55 years old in men and over 65 years old in women are at an increased risk. Gender, men are at a greater risk. Modifiable factors are the ones we can change in our lives to reduce the risk of high cholesterol. These include quitting smoking, managing high blood pressure, not eating a high-fat diet, but rather a low-saturated fat diet, and managing diabetes will cause less vascular damage to your blood vessels.
How is it diagnosed? It is diagnosed using a blood lipid profile test or using a coronary angiogram. This will be used if an onset of complications occur, like a suspected heart attack or stroke when a person presents with the typical symptoms. What are the symptoms? Just like high blood pressure, high cholesterol is asymptomatic. Secondary symptoms, for example, chest pain from a heart attack, one-sided weakness from a stroke.
Outcomes of unmanaged high cholesterol: heart disease, heart attack, stroke, peripheral vascular disease. These outcomes are very serious and can be life-threatening.
How to prevent, manage high cholesterol. Eating a low-fat diet, heart healthy. Reading labels is important. Exercising regularly, maintaining an optimal weight, taking medications to lower LDL cholesterol like statins. By quitting smoking, since smoking decreases blood vessel size and will increase blood pressure, causing the risk of cholesterol buildup to break off and travel to the heart and brain. Regular blood work should be done, especially on medications like statins, to monitor the therapeutic effect of treatment. These are the references used to compile the information in the video PowerPoint. The links are included for further information. We hope this video brought some awareness and knowledge regarding these two very common and very serious conditions that may affect your health and lives. Thank you for watching, and we hope you enjoyed it.